Massachusetts is a national leader when it comes to giving people the COVID-19 vaccine, but that's apparently not the whole story.
It's not the whole story. 5 Investigates' Mike Bodette examined vaccine data, discovered that some pockets of the population are still holding out and refusing to get vaccinated.
We know that communities of color have been some of the hardest hit by the pandemic. And here in Massachusetts and around the country, some of those same communities are lagging behind on vaccinations. Salem is known for its rich history, attracting visitors from around the world. But there's another part of Salem that tourists don't see. And that's also where fewer people of color are getting vaccinated. Data analyzed by 5 Investigate shows that white residents have been fully vaccinated at twice the rate of Hispanic and black residents.
They don't trust the vaccine.
They're thinking a lot of stuff. They're thinking they're gonna get it sick. They're thinking they're gonna get it something in his body.
A visit to The Point, a Salem neighborhood that's home to many people of color, is revealing.
I need to see what is the consequences of the first people shot first, you know? After some months, after that, I'm going to take it up. But I need to see what is happening to the first people take the shot.
Even some people who've been vaccinated are skeptical.
Like, to me, I think it's always an agenda behind this. You know, not to say anything, not to put the government under the bus or anything, but I think it's just population control.
It's not only an issue in Salem. Take a look at the town of Norfolk. 8 in 10 white residents are fully vaccinated, well above the state average. But fewer than 1 in 10 Hispanic residents and 2 in 10 black residents are fully vaccinated. That means in the same town, whites are 7 times more likely to be vaccinated in Norfolk than Hispanics. We found 71 communities in Massachusetts where whites were at least twice as likely to be vaccinated as black or Hispanic residents, or both groups. Not just cities, but suburban and more rural communities too. Maggie Brennan is president and CEO of North Shore Community Health in Salem. Why are some people resistant to getting the vaccine?
I think that there's a lot of misinformation out there. I think it's tough when there's such a volume of misinformation to counter that in a one-on-one in a community level.
Brennan says the Salem Family Health Center is working to build relationships with trusted leaders in the community, enlisting them to spread the word about why people should get vaccinated. They're also bringing the vaccines directly into neighborhoods to make them even more accessible.
We're going to move at the speed of trust, which is slow, right? Trust builds slowly. So, and unfortunately, this is going to take longer than we want.
The Baker administration sent us a statement saying, while our vaccination rates among black and Hispanic residents are almost double the national average, there is still more work to do. The administration has invested over $30 million in municipal and local vaccine equity initiatives to increase vaccine awareness and access through outreach efforts like door-to-door canvassing and mobile and local vaccination clinics.
Too many black and brown people still have not received the vaccine.
The Baker administration also connected us with Michael Curry, president and CEO of the Massachusetts League of Community Health Centers, who has a message for people who are not vaccinated.
It's very important that you get the science that is real, because the reality is we are jeopardizing our lives by not embracing the medical advancement that is COVID-19 vaccine.
Back in Salem, variants of the virus are only increasing the concern.
I think we have to be very careful. We're not back to normal. There's still something out there that can make you really sick and could kill you and your friends and your family. So the best thing to do is to take the vaccine to protect yourself, your friends, your family, your loved ones.
Brennan says she's worried about another wave of coronavirus infections among people who are not vaccinated, which is adding to the urgency to convince more people to get the vaccine. Mike Bodette, 5 Investigates.